Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, this past week, the president gave his big health care speech to Congress. The debate is on in Congress on the health care reform bills, and it's on Pennsylvania Newsmakers following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program, and as always, thanks for watching. Well, the health care debate, it is dominating discussion in the country, and it's going to dominate discussion on Pennsylvania Newsmakers this week. We have two experts bringing their viewpoints to us. First on the show is Dr. Stuart Shapiro. He's been on the show many times. He's the president and CEO of the Pennsylvania Healthcare Association. Dr. Shapiro, welcome.
Hi, Terry.
All right, I'll tell you what, before I get into this, and you have some thoughts that you've put into paper, you've written an op-ed piece that has appeared around the state. I want to talk about that. These are suggestions that could help move the healthcare debate along. Have you ever seen a debate quite like this? It's on all summer, not much leadership from the president. They're sort of ambling around without any direction. Is that kind of odd coming from this administration?
It is kind of odd, especially since the president understands social media.
Yeah,
and he should understand that today we're in an environment where you can't sit back. You have to take leadership. And especially on an issue like this, he's got to be very clear.
Yep.
And he's got to be able to bring the parties together.
Yep, and he's not certainly done that. You're right. Well, look, I want to get right to this point. Look, if the president of the United States would pick up the phone and call you and say, "Doctor, give me 3 or 4 ideas about what I should do," what's your suggestion to the president?
I'd be real clear. I'd say, Mr. President, don't just invoke Teddy Kennedy's name. Mm-hmm. Step into his footsteps. Understand that you have to take baby steps.
Right.
Follow Kennedy's lead on civil rights or disabilities. The first bill that really did it, took important key steps and laid out a roadmap. Then I'd put the following 4 elements into a roadmap. I'd say, Mr. President, lay out that universal health care is a goal, but we're not going to start there. Start with covering all kids. Mm-hmm. Start with mandating for large employers. Right. Second point, I'd say, Mr. President, define a minimum benefit package. Provide some subsidies for having it purchased. Make sure there's no discrimination for pre-existing illnesses. Make sure that it's community rated, and give up the public option. Mm-hmm. Don't let the liberals in the House dominate you. Mm-hmm. Then I'd come to the third point. I'd say, Mr. President, put in real cost controls. Medicare, when it was passed, did not. And the curve went like this, even though it was projected to go like this. When the end-stage renal dialysis program was implemented, or right. Part D, they said the costs would be here, they were here. I'd say, Mr. President, put in some real cost controls that pays based on quality of services, not quantity of services, which is the way we do it today. And I'd say, don't reimburse for brand new drugs or new treatments that have only marginal benefit. Mm-hmm. Make sure that they really pass muster. Right. And then I'd take a fourth piece. I'd say, Mr. President, bring in tort reform. Right. The only way to get Republicans on this bill is going to be with serious tort reform. Reduces defensive medicine, put in some tort reform, and we'll save $200 billion a year. Those 4 elements is what Teddy Kennedy would do. It's what leadership would do, and it will produce a bipartisan compromise.
Yeah, well, what's, I think, fascinating about this discussion is that the American people, when we started this debate, were for universal coverage. Not, and in a sense, for a public option until they figured out that the public option, in a sense, could compromise their own health care plan. In other words, that a public option could drive out of existence all private insurance, which is, I think, a real fear. And the other point that you make about tort reform is that maybe the president doesn't want to take on a trial bar. I mean, the trial lawyer is a big constituency. But on this program, over and over again, we've had folks like you come on and say, if we have tort reform, serious tort reform, that would reduce the costs, and you could still make sure that injured parties, plaintiffs, were taken care of.
Well, you have to make sure that when mistakes are made, and serious mistakes are made, that they're seriously compensated.
Yeah.
But to just practice the kind of defensive medicine we do today,
right,
to avoid frivolous lawsuits,
right,
is folly. If you look at the House bill, 1,018 pages. Tort reform is not mentioned. In the entire, all the Senate bills led by Democrats, tort reform not even is near the table. And that's unfortunate, because if you want a bipartisan approach, you have to eliminate the public option, which I happen to think was, in the end, will come back. And you could set up triggers so that it will come back if costs aren't controlled. So it's still there in the bill, but it's a backup. But unless you put in do it this way, health care reform is going to be lost in this Congress.
All right, we're going to take a break. When we come back, probably nobody knows more about the Medicare program than Dr. Shapiro. It's a huge program. It's important to Americans. We'll talk about that and more following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers. It's healthcare. It's the big raging debate in Congress and around the nation. Joining me is Dr. Stuart Shapiro. He's with the Pennsylvania Healthcare Association, one of the experts we call on from time to time to chat about healthcare. All right, Medicare. You know a lot about Medicare. First of all, tell our viewers out there, we got listeners, I guess, and viewers, about the Medicare program itself. It's growing by leaps and bounds in terms of the people who are covered by it.
Right. Pennsylvania now has about 15% of the population is over 65. They're all covered by Medicare.
Okay.
By 2020, that number is going to increase to 25%. Medicare is growing in both its cost and in its the number of people it serves. It is, in fact, very much a public option type program that we were talking about just in the previous segment.
Yeah, but what's interesting about it, it's a public insurance, in a sense, option, but it allows the patient to choose his or her own doctor. In other words, it doesn't control many aspects of the delivery of health care itself. Am I right or wrong about that?
You're absolutely right, and it's a fine program, and it's a program that the elderly in this state and across the country depend on.
Yeah.
But not only do they depend on it, the providers of the care who treat the elderly, whether it be in a hospital or a doctor's office or in a nursing home, depend on the Medicare program. Now, what the Congress is proposing in terms of health care reform is to take $500 billion out of Medicare over the next decade. Well, if they did that, the whole healthcare system would destabilize. And let me tell you why. And I'm just going to use nursing homes as an example. Nursing homes take care of two groups of people. Short-term rehab, usually after a hospital stay, usually paid for by Medicare. Then they take care of Medicaid patients, residents, and about 65% of those in nursing homes are on Medicaid. And those are there for the longer period of time. Medicare pays pretty well. Medicaid, the nursing homes lose about $15 a day on. So they're made up, they're able to stay in business by Medicare, which covers the losses on Medicaid. What the Congress has proposed is to literally take out $30 a day, starting on January 1st, if the bill were passed, of Medicare payments. So what happens is the nursing homes will no longer have the support of Medicare to shore up Medicaid, and they immediately start to almost not be able to stay in business. And the same thing could happen with hospitals and doctors. Medicare shores up the state Medicaid programs, not only in Pennsylvania, but across the country. And no one is talking about what's the entire impact on the healthcare system if healthcare reform passes. How's it going to affect the elderly?
Now, okay, let me ask you this question. I mean, taking the money out per se is one thing. removing a certain sum of money from the Medicare program that affects nursing homes and hospitals and all other physicians. But let me ask you another aspect of it. It has been cited by any number of studies that there is what I'll say waste, fraud, and inefficiency in the Medicare system. You're not talking about reforms that would get rid of some of those problems. You're talking about just an outright cut. Is
Correct.
that right?
No one's going to argue. And in fact, the federal government's done a pretty good job of eliminating fraud and abuse and waste in Medicare. Can they do better? Sure.
Okay.
Should they do better? Obviously.
Okay.
No one's defending that. But what I am saying is that you can't just remove hundreds of billions of dollars out of the system and expect the system to survive. Mm-hmm. The government here in Pennsylvania depends on the support from Medicare in order to make up for the Medicaid.
And that's not a relationship, I think, that's very well known. In fact, you've been on this program a lot. I don't think we've quite ever talked, maybe we did and I don't recall, talked about that. We've talked about the various programs, but not the linkage between the two, which I think, in a sense, you're making. This is the first time I've heard that.
Well, it's a critical issue. And you'll hear people in Washington say, well, Medicare was not created to shore up states' Medicaid programs.
I got it.
But the fact is, that's the reality we have.
Okay.
And if, in fact, in Pennsylvania, the cuts were made that are in House Bill 3200, which is their health care reform bill, and are in the Senate bill that was just put forward by Senator Grassley earlier this week, if those go through, the Medicaid system and the health care system in Pennsylvania is going to go down just like this because no one's talking about this.
Okay, a great update. All right, coming up, we're going to hear from Mike Fiaschetti from Highmark. We'll get the insurance industry's analysis of the health care bills, I should say, not one, but bills before Congress. All of that following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, joining me is Michael Fiaschetti. He's the market president of the Central Region for Highmark-Blue Shield, and another one of the healthcare experts we call on from time to time. All right, let's talk a little bit about some of these big aspects of healthcare that are before Congress. The president gave his speech last week. There's a big debate about public option. Is it good? Is it bad? The public now does not favor a public option for a variety of reasons. Talk about, well, first of all, what do you think about the public option idea?
Well, we do not support a public option. I will tell you this, though. Let me just step back a second. There's a lot more agreement than disagreement from our perspective about health care reform. I think a lot of folks, there's a lot of misinformation about the health insurance industry and whether we agree or disagree with the president on health care reform. We absolutely believe there's a need for health care reform because it's all about the cost. The costs are not sustainable.
Sure.
We don't happen to believe that a public option is the best way to go about health care reform.
Okay.
The public option, frankly, in the current H.R. 3200
the House bill,
would mandate doctors and hospitals at Medicare rates. In Pennsylvania, Medicare pays about 70% of what private insurers pay. Private insurers subsidize Medicare and Medicaid, as you just recently heard. So we think that that would actually drive more subsidies and drive people, you know, away from their current plans.
Isn't that the crux of the matter? I mean, isn't that the concern that the supporters of a public option are on the horns of a dilemma because they say that a public option would compete? The critics say the public option will drive private insurers out of the market, and that individuals will eventually opt into the public plan because you all can't compete.
Well, I think that's right, and we've all heard about the Lewin study, and that study was done nationwide. It was done for Pennsylvania as well, and it shows that more than half of the people would be driven to a public plan because of the cost advantage. And frankly, we believe that would drive some providers of care maybe out of business, and therefore create problems in the delivery system, create problems to access. I think the mechanisms are already in place. There's already plenty of competition. We need some reforms in the insurance markets. We need to eliminate the practice of medical underwriting, but then mandate that people take coverage. So we get closer to universal coverage.
Okay, great. You're on to the next subject I want to go to. Universal coverage is controversial. You know, we hear these figures, 45, 50 million. We know that, pick a number, 11 or 12 million people probably earn enough to buy some coverage and don't. Then we have the immortals, you know, the young kids who just say, we're not going to worry about it. And then there are others who are eligible for Medicare and Medicaid who don't sign up. I mean, that's hard to believe. They're eligible for these programs and don't sign up. So when you say we ought to have universal coverage, what does that mean to you?
Well, we absolutely support broadening coverage. There's a lot of people who are uninsured who are healthy, who are not in the pool, if you will, the pool of insureds. So you have a sicker population that's being covered, and people who are healthy can offset some of the costs of the people who are sick. And therefore, if you broaden that pool, you'll get more back to the concept of insurance, and costs will be more stable for everyone. So we really need to broaden the pool for everybody.
What about this notion, you know, the president keeps talking about people who pre-existing, I mean, the big example he often gives is pre-existing conditions, and it seems clear that if Congress does anything, and there'll probably be a consensus about this, that insurers won't be able to deny people coverage with pre-existing. Is there a way to deal with that problem, do you think?
Oh, I think there is. I think there could be mandates within the reform proposals that mandate that pre-existing conditions are covered, that there's no medical underwriting. But if you do that, then you have to mandate that everybody get in.
What do you mean by medical underwriting? Help, Mark. What does that mean?
Medical underwriting is the practice of evaluating each individual person in an employer group, particularly in small groups, groups of less than 100 employees. And what happens is if some of these people are sick, that whole group gets rated up or gets rated higher. If it's a healthy population, they get rated lower. Now, typically, that's younger males that are the healthier population.
Would you eliminate that and create larger pools of people to share the expense? Is that an idea that works?
Yes, we support the elimination of medical underwriting and pre-existing conditions, but there has to be a mandate. Everybody has to get in the pool so we get the healthy people into the pool.
Sure. All right, we're talking with Michael Fiaschetti from Highmark. We'll be back to continue this healthcare discussion after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark-Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program for our final session with, is that right? Final segment with Michael Fiaschetti. He's the market president of the Central Region of Highmark-Blue Shield. Mike, let's talk about another aspect of this. I mean, there's this big debate about how we should pay. This is important because it's, after all, the government's money. It is an insurance money. It is, after all, a huge cost driver into the healthcare system. Should we be paying fee-for-service? Should we be paying for quantity, for quality? Should physicians and others be put on straight salaries? I mean, this is complicated. Give me your thoughts about that.
It is very complicated, and it's one of the issues that is driving costs. Today, payments are primarily on a fee-for-service basis, which means that there's an incentive to do more, to do quantity, not quality, and we need to evolve the payment system to a system that pays for quality. that pays when someone's not readmitted, when someone doesn't get an infection, that pays more for good quality, that pays based on evidence-based practices too, and a lot of those are out there, you know, how to treat a diabetic or how to treat an asthmatic or various things around heart disease. There are absolutely evidence-based protocols. We should be paying for the use of those protocols. So we have to evolve the payment system. Unfortunately, there's not a lot in the legislation about paying for quality, and I think that's something that that all the reformers need to look at, that the president needs to look at over time. That's not going to happen overnight.
And is that in the long run, that would, I think, reduce costs, if I understand what you're saying. Is that correct?
Absolutely,
because
it would reduce costs.
Insist on more uniformity of medical procedures and practices. Is that the...
That's a real key, Terry. There's so much variation in the practice of medicine, and certainly I think Dr. Shapiro could have talked about this better than I, but there's variation even within the state of Pennsylvania, depending on where you live, will determine how you get treated for a certain illness. And so we've got to eliminate the variation and pay for best practice medicine.
Yeah, let's switch gears a little bit to these co-ops, these cooperatives that may kick in should we not have a health care option. It might be pools. They're coming out of the Senate Finance Committee. We don't know exactly yet, and it'll take some time to fully understand the ramifications. How do you think these insurance exchanges, you know, could compete? And it's pretty complicated. Explain to our viewers what you think about that.
I think there's a couple different things there, Terry. First of all, if there's the notion of having an insurance exchange like what happened in Massachusetts, there's a connector. It's called a connector that connects people to health insurance. We could support that if it's done at the state level. If there's an exchange or a connector that connects people to health insurance within the state. And the reason we would support that at the state, not the federal level, is because there's a lot of consumer protections embedded in state regulation, solvency requirements, etc. And we think that people should still have those protections so that they get what they pay for. So if there's going to be an exchange, particularly for individuals and small businesses, we would support that exchange at a state level, not at a federal level.
All right. Well, thanks for coming in. Look, we want to have you back as this debate goes on. Is this going to? We have about 30 seconds. Is this debate going to go on for some time?
I think something will be done by the end of the year.
Yeah, I think you're right. All right. As always, thanks for watching Pennsylvania Newsmakers, and you all stay healthy.